Hey friends, and welcome back to Mama Doc Baby Doc Podcast.
I'm Renda, a board-certified OBGYN physician.
And I'm Rachel, a board-certified pediatrician and Renda's first and best daughter. Just kidding. Today, we're going to talk about facts versus myths on what you can and can't do during pregnancy. Since being pregnant, there's so many rumors and things that you hear about what you can and can't do when you're pregnant. Everyone will tell you, all the apps will tell you what you can and cannot do. And you really feel like people are judging you all the time on what you're doing, what you're eating, what you're drinking, what you should and shouldn't be doing. And I've noticed a lot of the rules that they have are really major life changes for people. I mean, if I can't have my caffeine, okay.
Especially you, that's right.
Yeah, major life changes, okay, people. So it can be hard to believe some of the things and to know like the reasons behind it. So we're going to chat about that today. So the first thing we wanted to talk about is caffeine. I love caffeine. And just learning that I had to limit my intake during pregnancy was really hard for me. And I think most people really love caffeine. Like everyone loves coffee.
Yeah.
Everyone likes to drink tea every day.
Right.
And I don't really like coffee, but I learned to love energy drinks in residency. I would chug them. And they're like 200 milligrams each. But they make me feel alive. I love them so much. Especially Alani Nus. If you know what an Alani Nu is, you know they're delicious.
I don't.
And they make you feel really good. They're like a drug. It's awesome. But giving them up has been really hard for me. And you're already tired when you're pregnant. Really not just tired, exhausted all the time. Right. And so I feel like it's not fair, Mom. It's not fair that we can't have caffeine. So what's the big deal? Why can't we have it?
Well, the question, can you have caffeine if you're pregnant? Or you can't, the statement, you cannot have caffeine if you're pregnant, is false, or at least it's not true. So the data on caffeine is really mixed, and the quality of the data is poor. The medical studies that have been done with caffeine in pregnant women that are being used to make the recommendations to limit caffeine are really poor studies. So, first of all, it's challenging. It's a really challenging thing to study for a lot of different reasons. Most of the studies that we have are retrospective studies, and that means that the patients are asked after the fact how much caffeine they consumed. And it's not a real-time assessment, and so it's subject to recall bias. People may not accurately remember, or they may say a lower amount because they don't want to look bad or feel like they're doing something that they shouldn't. So maybe the answers aren't always accurate. And it's also difficult to estimate how much caffeine people are drinking because there's such a wide variation of caffeine content in the different beverages, right? And there's a huge difference in serving sizes. I mean, you can get an 8-ounce cup of coffee, or you can get that 20-ounce serving. And even just straight black coffee, the amount of caffeine in coffee also varies. It's not all the same. It depends on the roast. And I don't know if you know this, but light roast actually has more caffeine content. And it also depends on the coffee bean itself. So coffee can vary from 72 milligrams to 140 milligrams in just one cup of coffee.
That's different. It's a huge difference.
Yeah. It's like double, right? And even how the coffee is brewed can affect how much caffeine you get. Okay, and then there's teas and sodas and your favorite energy drinks and even chocolate, right?
Yeah. And I've eaten a lot of chocolate.
Yeah, I know. Yeah, you can try that, honestly. And also the medical studies that they don't account for the fact that our bodies are also different. We metabolize things differently. Some people are actually slow metabolizers of caffeine, and others are fast metabolizers. So if you're somebody who metabolizes caffeine slowly, that means the caffeine hangs around in your bloodstream longer than someone who's a fast metabolizer. It's this complex interplay of our detoxification systems in our bodies and how healthy your liver is and your kidneys, and whether or not you're deficient in some vitamins or minerals needed for the detoxification process. So it's really complicated. Now, with all that being said, here's the information that we do have. Large amounts of caffeine consumption may increase the risk of miscarriages. The studies are really conflicting. Yeah, there's one big study that said, yes, high amounts of caffeine do contribute to miscarriage. And then we have another pretty good sized study that says really it doesn't have any effect at all, right?
Yeah, and I know that caffeine does cross the placenta. So that means that whatever caffeine you're drinking, your baby's getting that same caffeine. So
that's right. The baby also gets a hit. So then also just being pregnant, just the fact that you're pregnant slows down your ability to metabolize caffeine. And the farther along in pregnancy you get, the slower your body will be at clearing caffeine from your system. So looking at the data from the studies that we do have, the data shows that higher levels of caffeine consumption above 300 milligrams a day, so that's like 3 cups of coffee per day, that level of caffeine consumption has been associated with adverse reproductive outcomes. Now, the earlier studies have shown that lower levels of caffeine consumption really had no effect at all on pregnancy. But some newer studies have shown maybe there is some potential harm. So, this data, it's really mixed. So let's talk about fertility. If you're someone who's trying to get pregnant, the data shows that lower levels of caffeine intake, 300 milligrams or less per day, with that level of caffeine, there's no association with an inability to conceive. So low levels of caffeine are probably okay. So those of you wanting to get pregnant, you can have 300 milligrams or less of caffeine a day without any adverse effects.
That's good to know. Yeah. And, when we look at pregnancy outcomes at typical levels of caffeine, there doesn't really appear to be any association with caffeine and adverse outcomes. So no increased risk for congenital anomalies, birth defects, miscarriages, fetal growth restrictions, or really even preterm birth. So
that's right. Yeah, that's right. And actually, moderate or lower amounts of caffeine consumption, especially early in pregnancy, can actually decrease a woman's chance of developing gestational diabetes in pregnancy. That's interesting. And there's a newer study that suggests that low to moderate caffeine intake in early pregnancy may also decrease chances of developing preeclampsia. Yeah. Drinking caffeine outside of pregnancy has also been shown to decrease the chance of developing diabetes. So for people that aren't pregnant, a little bit of caffeine can not
Good to know. Good to know.
I know.
I like these studies.
I know. So Rachel, tell us a little bit about what are the childhood outcomes when moms are caffeine drinkers?
Yeah, so like I said before, not a huge association with caffeine and adverse outcomes. But if mom is a heavy drinker of caffeine, a heavy caffeine consumer, like I was, drinking a lot of coffee or a lot of energy drinks, it can result in neonatal withdrawals. I have seen this, the babies, they come out, they're born and they are very jittery, very shaky. They have withdrawals from caffeine, just like you do when you don't drink caffeine. But we don't have any studies that show that it will affect the IQ of the baby. So nothing that shows that the baby is going to have long-term effects from the caffeine. There are some studies that show correlation with mom's high caffeine intake and childhood obesity, higher BMI in kids, shorter height, and some correlation with behavioral problems or ADHD. Okay. But in some of these studies, it's kind of hard to know what's environmental later in childhood versus what is actually coming from the caffeine intake from the parents. So
perfect.
Yeah.
So the final result then, when we look at all the data, here's what ACOG, that's the American College of Obstetrics and Gynecology, recommends. Yes, you can consume caffeine in pregnancy, but you should limit the amount. So for pregnancy, if you're trying to get pregnant or if you're breastfeeding, you should limit consumption to 200 to 300 milligrams or 2 to 3 cups of coffee per day.
Yeah, that's doable for sure, I think. Energy drinks where they're already 200 milligrams, that's why I kind of decided to cut them from my diet when I was pregnant, just so I could get caffeine in other ways throughout the day as well. So I can have little hits here and there throughout the day. But that's just my personal opinion and what I did to, make it through my day. But, I cannot wait to get back to drinking my Alani News. If you know, you know, okay? Okay, so that was caffeine. Second, I've heard so much about not being able or not being allowed to sleep on your back. When you get farther along, you can already not sleep on your stomach. And I have a hard time sleeping on my right side. So I'm just left with my left. So it doesn't leave a lot of room to wiggle or move. And it's really frustrating. So what's up with that? Why can't I sleep on my back?
Well, this one, Rachel, is actually true. After 20 weeks, you really shouldn't sleep on your back. And here's why. As your uterus gets bigger, when you're laying on your back, flat on your back, your uterus actually pushes on your inferior vena cava. And that's the large blood vessel coming up, bringing blood up from the legs. It's behind the uterus next to the spine. So that large vein that's bringing blood up from the lower parts of your body back to your heart, then that blood gets pumped out to the lungs and goes to pick up more oxygen and then gets circulated through your body again. So it's the deoxygenated blood trying to get to the heart and lungs to get oxygen. So when your big uterus is laying on top of it, the inferior vena cava, it gets compressed and it doesn't let the blood get back through to get to the heart and lungs. So the entire lower half of your body, that's a pretty significant amount of blood, right? So the slower return of blood to the heart means that there's less blood available for your heart to pump out. And that means decreased blood flow going to your uterus and your placenta and your baby. So there have been some small studies that have suggested that sleeping on your back can actually increase the risk of stillbirth. And we think it's because of that blood flow issue. Now, it's important to know this risk is extremely low and the data is not great, but there have been some studies that have suggested that. Now, the other thing that can happen on your back is something called supine hypotensive syndrome. So the compression of the blood vessels causes your blood pressure to drop, and then you can feel kind of dizzy or short of breath. Trust me, you will not feel good, right?
Yeah, that doesn't sound good. Yeah. Okay. That's okay. I can do that then. I won't sleep on my back. But why do they say don't sleep? Why do they say you should sleep on your left side? What's up with that?
It's because the inferior vena cava is on the right side of your spinal column. So sleeping on your left will actually tilt your uterus away from it. But in truth, you can sleep on your right side or your left side. It really doesn't matter. You just don't want to be flat on your back. So please hear this. If you wake up in the middle of the night and you're on your back, you are not going to kill your baby. Do not panic, okay? Just roll to the side and then go back to sleep and don't worry. I tell patients to put a pillow behind one hip. You really only need a small tilt, like 20 to 30 degrees.
Yeah, that's super important, to remind everyone. If you wake up and you are on your back, you didn't do it on purpose. Don't freak out.
Right.
Like you said, the study showed that even the rate of maybe hurting your baby is super, super low anyways. So, yeah, that's important to say for sure. Okay, number 3. This is my favorite one for sure. You cannot eat deli meat while you're pregnant. And I'll be honest, I did not follow this rule very well.
Ooh.
I love sandwiches and Jersey Mike's and all the things. But we've all heard a million rules about what you can eat, what you can't eat. No deli meat, no hot dogs, no sushi. And, you know, at some point it's like, you guys are just making up these rules to be mean. What's going on?
No, they're not making up the rules.
But, you know, I know this is partially true too.
Right.
You know, it is the official recommendation.
Right.
And I know that it's from a bacteria called Listeria. Listeria is found in soil, water, cattle, poultry, all these things that we eat, and it's a foodborne illness. So you get an illness called listeriosis if you ingest something that has listeria in it. And it is very scary, one of the most serious types of food poisoning. Some of the symptoms that you can have, they can be mild, sometimes flu-like symptoms, some like fever, chills, you know, your belly's upset, muscle aches, diarrhea. It can also, though, cause stiff neck, confusion, loss of balance. Right. So some really scary things. But what's even scarier is the symptoms may not appear right away. So they can come as late as 2 months after you've eaten the contaminated food with Listeria.
Which is crazy.
So, so you might never know what you got it from. In pregnancy, many women don't get any symptoms at all, is what I've heard, if exposed.
That's right.
And you might not even feel sick and still pass the infection to your baby through the placenta.
Right. Yeah. And, you know, while the infection may not cause you any problems, it can be serious for your baby. It can cause miscarriages, stillbirth, and preterm labor, right?
Yeah. Babies born with listeriosis can have really serious issues. Blood infections, brain infections. It can even cause lifelong health problems for the baby. Intellectual disabilities, right. Paralysis, seizures, blindness, and even death in newborns. It's very scary. And I've actually seen this a couple times in brand new babies, and it's very, very sad.
Yeah, that does sound sad. Mm-hmm. You know, what's funny is pregnant women are also 10 times more likely to get listeriosis than the general population. But still, it's a really rare condition. There are roughly 1,600 cases of listeriosis in the United States every year. And about 200 per year are in pregnant women. And that's out of about 4 million pregnancies per year in the US. So it's really rare. And I personally have never seen a case of it in my career, but it is still a possibility.
Yeah. So what can you do to prevent it?
Well, when you're pregnant, the official recommendation is to avoid eating the following foods. Now, again, listeriosis is rare, and not everybody sticks to these recommendations, but it is what is currently recommended. So number one, you should avoid unpasteurized milk or any food made with unpasteurized milk, such as some of the soft cheeses like brie. So if you look on the label, it will say if it was made with unpasteurized milk.
No charcuterie boards? What the heck?
Well, no, you can have it as long as you get brie that was made from pasteurized milk and not unpasteurized milk. Yeah. Then the other thing is you want to make sure that you cook your hot dogs. And if you cook your hot dogs and deli meats to at least an internal temperature of 165 degrees Fahrenheit, so you just make sure it's steaming hot before you eat it.
Yeah, and you know, I eat like a kid, if you know me at all, and I love hot dogs. I remember texting you. I was at the movie theater, like, please, can I get a hot dog? So I can have my hot dogs as long as they're cooked well, and I can have hot ham and cheese sandwich. Is that what you're telling me?
That's right, yeah. Now, you should avoid refrigerated pate or meat spreads and smoked salmon, which is a big one here in Alaska. That can have listeria too. So it's recommended that you cook your salmon thoroughly. Now, the other thing that people don't think about, raw fruits and vegetables really should be washed well prior to eating. And you should avoid any raw or undercooked seafood, eggs, poultry. So sushi is also incredibly popular, and the raw fish, it can contain listeria. So cooked sushi is always safe. what I tell patients is they really should avoid salads that are made in the store, like chicken salad or tuna salad from the deli, because those can be contaminated with Listeria. Now, if you want to make chicken salad or tuna salad at home, that's perfectly fine. You know, the way that we kill the bacteria Listeria is through cooking or pasteurizing. So again, it's incredibly rare, not likely to be a problem. And even if you don't follow this rule, still the official recommendation is to avoid all these foods. So other things that you should be doing in general, hand washing, right? We all learned this during COVID, good hand hygiene.
Yes.
Also, wash your cutting boards and utensils with hot soapy water after any contact with raw meats or poultry or raw fruits and vegetables. So some people that I know like to use one cutting board for meats and a separate one for vegetables so that there's no cross-contamination. And also you want to wash your knife in between. So you can eat deli meats. Yes, you can. Just heat them to 165 degrees before you eat them. Yay.
That's awesome. That sounds good. I'll do that.
Yeah. So the next thing we want to talk about is sex. Okay. The question is, can you have sex while you're pregnant?
I'm
And
going
the
to
answer.
out for this one. Talking about sex with my mom is a little weird. So
Okay, so Rachel, you've already been busted. You are pregnant, so I'm pretty sure that has occurred. Okay, all right.
Okay, I'll just be over here. You let them know what to do.
All right, whatever. So one of the most important things that you can do for your baby is to have a healthy relationship with your baby's dad, right? And a lot of that relationship includes sex. Sex is an important part of your relationship. Now, sex is generally safe during pregnancy. There are, of course, some pregnancy complications like placenta previa or abruption or an ectopic pregnancy, pregnancies at high risk for miscarriage, maybe incompetent cervix, preterm labor. In those conditions, sex could be dangerous. So if you have one of those conditions, this does not apply to you. If your doctor tells you to be on pelvic rest, that means no sex. Okay?
Okay, so talk about when you should stop having sex.
Definitely when your water breaks, you should stop, Rachel, okay?
Okay.
Stop, go to the hospital or your birthplace to get checked for labor. Okay. It's funny. Some women will actually experience an increase in their sex drive during pregnancy, and that's due to the pregnancy hormones. So if you fall into that category and your pregnancy is uncomplicated, then I say go for it. Now, as far as sex harming your baby, you don't need to worry. Vaginal penetration cannot get to your baby. Your baby is inside the uterus in a sac filled with fluid, just floating around in there. And the uterus itself is a muscle layer of protection. You know, your cervix is usually more than 4 centimeters long, and there's cervical mucus that plugs up the cervix and also serves to keep the baby safe. Now, as far as physical comfort, there are going to be changes to your body, right? And that can impact how you experience sex. You may feel more moist. The pregnancy hormones cause an increase in the physiologic vaginal discharge, and that is not harmful. The vaginal area can be more sensitive as a result of the increased blood flow that occurs to the vagina and all the pelvic organs during pregnancy. And you know, your breasts can also be quite sensitive and you may not want them to be touched at all. And your nipples can even be a little painful sometimes when touched. So just know that that's all normal. Those are normal changes that happen during pregnancy. So what about positions? Well, obviously, there may be positions that could be a little bit more challenging when you're pregnant. But as far as positions go, you can do anything, whatever position you feel comfortable with. There's nothing that we say is off limits, really. Now, toward the end of your pregnancy, being on your back isn't ideal, right? We've talked about that because of compression of the inferior vena cava. So you may want to try other positions besides being flat on your back. Now, just know that what feels good and what doesn't feel good may change throughout your pregnancy. So make sure you're having these conversations with your partner. It's okay to talk about it. Some women during sex may experience contractions, especially during orgasms. You can actually get contractions of the uterus. That is totally normal. They're usually mild, they subside quickly. Also, some women could have mild spotting of blood after sex because the cervix is just a lot more sensitive and it can bleed when it gets bumped. That should be very mild. It should just be a little spotting and should subside very quickly. Now, you can always call your doctor if you have any questions or concerns. One of the most common questions I ask when someone comes in with vaginal bleeding in pregnancy is, have you had sex in the last 24 hours? Because very often that's the case.
I have a question. Can having sex make you go into labor early?
Well, that's a good one. So, as far as sex stimulating labor, the data is really mixed. Certainly, patients with preterm labor are told to avoid sex, right? When moms who are full term come to me and want advice on how they can get labor started because they're ready, right? I often will tell them that their husband's got them into this mess and he can help them out. And sometimes it works, but sometimes not. So I think it depends on if the body is really ready for labor or not. Certainly, the prostaglandins that are in the semen can help to soften the cervix and get it more ready for labor. Okay, Rachel, back to you. You can come back.
I'm here. Some of that info was actually really good, so thank you.
Okay, good. All right.
Okay, moving on. Anyways, the other one you always hear is you should not change the kitty litter. I don't have a cat. Not really a fan of cats. Sorry to all the cat people out there. But it actually is true. And it's because of another infection called toxoplasmosis. And it's a parasite that's found in the cat poop. And it's a disease that results from infection from that parasite.
Right. And most of the time that infection occurs by eating undercooked infected meat, notoriously pork, or in Alaska where I live, it's bear meat. The pork and bear meat both should be thoroughly cooked before eating, right?
Who's out there eating bear meat? That's so
People hunt in Alaska and we eat bear. We eat meat.
That's wild. But you can also get it from eating, or not from eating. Oh gosh, from eating cat poop. No, please don't eat the cat poop.
Probably could, but don't.
But you can get it from infected cat poop. And it usually happens when you're changing the litter box, the poop is dried out, you shake it around, you know how you get it out of the cat box. This light doesn't want to stay on for me. And some of the particles, when you're shaking it, aerosolize, and then you breathe it in. So you don't get it from petting cats or having a cat scratch you. So don't freak out from petting your cat, but you get it from breathing in infected, aerosolized cat poop. So yes, have someone else please change your cat litter for you. And this is important that you don't get it while you're pregnant, because you can transmit it to your baby. Vertical transmission across the placenta will send it to the baby, the developing baby. Most women affected have very mild symptoms to even no symptoms, which makes it even scarier. You won't know you're sick.
Right.
And then most babies have congenital toxoplasmosis. And they're asymptomatic, but some serious complications can result, like neurologic problems. So we should really do what we can to prevent it. Some of the complications that can occur to the baby are fever, fluid on the brain, an abnormally small head, because they're getting the infection while they're developing, so their head and brain don't develop normally.
Oh, that's sad.
Yeah, enlargement of the spleen, liver, jaundice, seizures, calcifications on the brain, and eye infections. And these kids they have long-term problems. They can have seizures, congenital deficits, hearing and visual impairments. So a lot of really scary, bad things. Just have someone else change your kitty litter, please.
Yeah, just have someone else change the kitty litter, right?
Yeah.
Yeah. And there are so many other myths out there about what you can and can't do during pregnancy. So I think, Rachel, we should probably do an episode 2 of this.
Yeah, for sure.
So comment below or message us if you have other rules you have heard that you want more information on, right?
There's a lot of other ones I've heard too, so
Right,
I'll be commenting and messaging you.
Okay, good.
So you can get some more info for me. But to sum up today's podcast, what I've learned, I can have 2 cups of coffee per day. I don't really like coffee, but you can have 2 cups of coffee. I shouldn't sleep on my back. I should sleep on my side, probably my left side. I need to cook my hot dogs and deli meat, and I can have all the sex I want. Don't tell my mom. and if I had a cat, then John, my husband, he would be changing the cat litter for me.
Yeah, that sounds right. Perfect. And if you have any other questions, be sure to talk to your doctor.
Sounds good. Well, that's it for this time. But comment below and let us know what else you want to hear or see. Have a good day.
Thanks for joining us. Bye.
Bye.